My name is Casey Height. I'm the CEO of Aeroflow Health. My brother started the company in 2001. Our grandmother was staying in a nursing home here in Asheville, and she was on home oxygen, and the provider was consistently not showing up, or the machine she had was breaking down all the time. I guess I was 23, 24. We both hated the companies we were currently at. Him and I had always wanted to do something together, and like, well, why don't we look at this home oxygen thing? And the reality was, neither of us knew what we were doing. We didn't know much about the industry, and neither of us knew how to be leaders. We approached things the same way that other places did that either of us had worked. Unfortunately, we were looking for what people were doing wrong. The turning point for this organization and when things changed really was when my brother passed away. I was completely destroyed. He was my best friend. He was a brother, but he was everything to me, and I was everything to him. I was so emotionally destroyed that I went to our team at the time and I said, I can't do it. I was broken into pieces, and I could no longer manage. I could no longer keep up with things. And I really had no choice but to put the control of the company into the team's hands and the employees' hands. After a couple months, and actually after about a year, the company started to turn around, and I realized, I've been the one holding this company back. We were doing it all wrong. It seems simple today because it's how we operate, but the more you trust people, the more trust you get in return. And the more I put my faith in this Aeroflow's employees, the more success we have. We had and we continue to have. Some of the things I'm most proud of is seeing how individuals have grown within the organization. Jennifer Jordan, again, starting as a customer service person. Lauren Bennett's another great example. Both of them started in customer service. And now Lauren Bennett is the CEO of the organization, and Jennifer Jordan is the director of the Mom and Baby division. There's example after example of that happening within the organization. And for me personally, the satisfaction I get out of coming to work each day is seeing folks like that flourish. I think that's what makes us different. None of us should ever be above doing any job within this organization. None of us should ever put ourselves above anybody else. It's not something that they do because they think they need to be that way. I really think that the team, it's a value we all share, and we had it before we came to the organization. It's just who we are as a group. The evolution of our company has been defined by the evolution of the individuals who work here.
Jennifer Jordan, Vice President of the Mom and Baby Division. I work with the Aeroflow breast pumps team. We are committed to providing world-class customer service and an experience for new and expectant mothers to be able to get their breastfeeding supplies and educational resources through insurance. I think Aeroflow is headed in a direction where we are remaining incredibly focused on our core competencies. We've realized that we can utilize technology to make what seems to be a process that can be incredibly overwhelming simple. When we set a goal and set our mind to it and work together as a team, we achieve it. One recent goal is the 1 millionth patient served. Our team has serviced over 1 million patients in a rolling 12-month period. We have had a saying forever here at Aeroflow, and it's follow the 3 C's. Do what's right for your customer, coworker, and community. We truly believe that when we do what's right and we put our patients first, growth will follow. By leaning into this technology-driven approach, we're making healthcare accessible and familiar for so many more patients than ever before. The belief that health should be standard, I'm so passionate about that. When we lead every patient interaction with empathy and the understanding that this may be the 100th patient we've talked to this week or the 1,000th order we've processed, it could be the first experience for this person. They deserve that health is standard for them. We can be a part of their health journey. We can be a part of their empowerment, and we can be a part of bettering their lives when we live by our core values.
My name's Ryan Bullock. I'm the Chief Strategy Officer with Aeroflow Health. I have spent time in various areas of the organization, such as operations and billing, revenue cycle support, spending time with our software engineering team. And then today, as Chief Strategy Officer, I get to spend time with our teams, which is really exciting to see what they're doing day in and day out and find those barriers that they're having to operate within and come up with ideas as to ways that we can address that through advocacy groups, health plan partners, state and federal legislators to try to overcome those barriers ultimately for the patients that we serve every day. Advocating for patients is working with groups such as the National Foundation for Continence to help provide knowledge and information to legislators and health plans as they're developing their medical coverage guidelines for the patients that we're servicing. Most recently, we've worked in North Carolina with state legislators and our state association to eliminate sales tax on breast pumps and diapers. And we think that goes a long way in creating choice and options and removing the barrier to the patients to be able to access the care that they need. It's not just about generating revenue. For those patients to be able to have a voice and be able to share their story is the reason behind what we're doing. We focus on working with our health plan partners, providing data so that they can help make a better informed decision. And it goes back to that patient-centric care. We're touching those patients on a daily, weekly, monthly basis. A lot of times we find out that the patient's pregnant before the health plan does. And for the health plan, it's very important for them to know and understand the health care that may be needed for that patient. Some of the exciting partnerships that's helped fuel Aeroflow to where it is today is really centered around those patient stories. The number of reviews is remarkable, especially compared to competitors in this space, and I think has played a very special part in propelling Aeroflow to where it is today. As I remember Don Haidt, one of the founders, used to say is that it takes each and every one of us. The principles of It Takes a Village is deeply embedded in the organization. What's going to propel Aeroflow to the next level is each and every one of us contributing to the overall goal and mission of the organization.
Hi, my name is Lauren Bennett, and I am Chief Operating Officer at Aeroflow Health. I've had the opportunity to really grow my career here. I started as an inside sales rep with our breast pump team, and most recently was Vice President of Aeroflow Sleep. Operations over the next few years is really going to be about driving efficiency and scalability. My biggest focus is our Height Fulfillment Center. They've done an incredible job, and we have a really awesome team there. We're really working to upgrade the Height Fulfillment Center, bring some more technology to what they do every day. I'll be really focused on ensuring that we don't have one piece of the business that is excelling at a pace that's faster than another piece of the business. A big part of that is making sure that I'm aware of what each of the business units is doing, what their long-term plans are and what their growth plans are to ensure that we have a solid foundation to reach our next milestone. Our employees are our absolute largest asset that we have. Making sure that we're investing the money, time, and energy into the right people, into identifying talent, into bringing people up through Aeroflow who understand not only our mission, but also the process as a whole. I think a huge part of Aeroflow's success is our consistency and being able to deliver an excellent experience for our patients time after time after time. We are the absolute best at what we do. And that is only possible because everybody works together to make it happen.
My name is Marshall Staten. I'm Aeroflow's Director of Human Resources. Our HR team plays a role in just about every facet of the employee experience at Aeroflow, whether that's the recruiting process and interviewing, onboarding and training, but also making sure that people have quality benefits and they're paid accurately and on time. At Aeroflow, our people are absolutely everything. As a company that's been built on customer service over the last 20 years, we cannot operate without the phenomenal people that come to work here every single day. We have had tremendous growth. Back in 2020, at the beginning of the pandemic, we had roughly 250 employees, and heading into 2024, we have 800. Our core values and our mission are certainly a reflection of our commitment to our patients, but they're also playing an important role in the culture that we're trying to build as a company. We want to make sure that Aeroflow is a company that our employees are proud to work for, and also one that they want to grow with year over year. We are so fortunate that we work in an industry where we get to take care of people, but we also do it with our employees. And coming into the office and seeing people that are proud and happy to work here is the most rewarding thing that I've experienced in my entire career.